Coming up on the FSR Sarc Fighter Podcast, an exploration of one of the strongest theories into the cause of sarcoidosis.
What we're looking at is a particular exposure called particulate matter, and that is part of the pollution in our air and is one of the 6 criteria air pollutants regulated by the EPA.
Dr. Mark Mallozzi at National Jewish Health in Denver is working to figure out what we might have breathed in to trigger sarcoidosis.
There's different sizes of particulate matter, and then within that, there's different species of particulate matter.
Everything in the air that you never knew was there, coming up.
This is the Sarc Fighter Podcast, living with sarcoidosis and other rare diseases. Here's your host, John Carlin.
Hello, this is episode 155 of the FSR Sarc Fighter Podcast. I'm your host, John Carlin. The date of this recording, January 12th, 2026. And today's guest is Dr. Mark Mallozzi. He is a researcher in Denver at National Jewish Health Hospital. And we're going to be getting downright granular today. He's going to be talking about the stuff that's in the air, stuff that we all breathe in as we're just out there going about our daily lives. And apparently there's a lot more in the air than just the oxygen and the nitrogen and all the other things that we learned about in 8th grade science class, all right? And a lot of this stuff is measured in microns. And he's going to describe the ones that are thought to be the most likely to trigger the immune response that then results in the granulomas that are, in fact, sarcoidosis. Now, that's me speaking in layman's terms. So I remember when I was diagnosed, they said, well, you have non-caseating granulomas, which none of that made any sense to me. It still only makes just so much sense, but we know that our bodies have some sort of an immune response, and all of these cells come rushing to some part of our body that our immune system thinks need help, and in the process they do damage instead of help. So you cut your finger and they all rush in and they fix your cut on your finger. But all of a sudden, if they show up in your heart or on your spinal cord or in your lungs, that's a bad thing. And so you probably, unless you're new to the show, you probably already know that. So, but what triggers that? What causes that? And if we could turn it off, could we essentially turn off sarcoidosis? And that's definitely me speaking in layman's terms, but those of us who are not in the medical field are just always trying to wrap our heads around this. So that's what he's looking into, and the research is fascinating. You might remember during the terrible wildfires in and around Hollywood last year that FSR put together a program really quickly as that situation escalated to try and provide N95 masks to firefighters because of the particles in the air. And of course, you probably by now have heard of the spike in Sarc cases from those exposed to the dust clouds during the 9/11 attacks. It's absolutely a huge spike and mostly to first responders who stayed there, but also other people who were exposed to that dust, especially in the immediate days after the attacks and when the buildings fell and there was just that huge cloud of dust. Well, there was something in that dust that caused sarcoidosis in a lot of people. And so that's one of the clues that we have, right? So during my talk with Dr. Mallozzi, which I recorded, I want to say about a week ago, a little bit more than a week ago, as we're recording today on January 12th, I asked him about all of that, and he's really got some great insights, and it's fascinating stuff. So that is coming up in short order. here on the FSR Sarc Fighter Podcast. But I just want to give you a quick update. If you've listened to the last couple of episodes going back to just before Thanksgiving in 2025, you've heard me talk about rupturing my Achilles tendon playing pickleball, which I resulted in surgery, and I came out of surgery in a cast, and I stayed in that cast until just before Christmas. And now I'm recovering wearing a boot that might as well be a cast. It goes all the way up to my knee and essentially locks everything in place just like a cast would. The only difference is I can take it off when I shower. For a long time, I was actually sleeping in it, but for the last week or so, I have said the heck with it. I don't know if I'm supposed to, but I have. And I'm not sleeping in the cast, which is in the boot, which, as you can imagine, is much better. But as of last week, I was then cleared to walk in said boot without my crutches, which I was hobbling around on in that in-between phase for a few weeks. So now I'm back at work. I do use one of those knee scooters if I have to go very far. I'm moving pretty slow. I got to tell you, everything is a process. I can't put any weight on that bad foot without the boot because of the way it positions my heel up in the air. They've got a wedge in that boot that keeps my heel elevated inside. And if I was to just take off walking across the floor, I probably would tear that tendon again, and I'd go back to surgery and all those others. I don't even want to think about it. But they have told me not under any circumstances to put any weight on that foot unless it's in the boot, and I haven't. But so what's like the end result of that? Let's extend it out a little bit. I need to pile all my clothes for the next day on the end of the bed. So when I get up in the morning, I can get dressed. Excuse me, I can get dressed with the boot and begin to move around. And heaven forbid, one day today, and this is not the first time it's happened, so one day and today, I forgot to put my socks at the end of the bed. So that means I need to strap the boot on, then hobble over to the dresser, get my socks, come back, sit on the edge of the bed, take the boot off, put on my socks, then put the boot back on. That's a very labor-intensive process. The boot has 4 straps. They're Velcro straps. They're kind of a pain in the butt. And you got to pull it tight, and you got to get it just in the right position, yada, yada, yada. You don't want to hear about all that. But and then one morning, the morning I started to talk about, not this morning, I got out of sync. I had forgotten to put several items of clothing on the bed, and I got mad about it. And so I think by the time I got through putting the boot on, taking it off, hobbling over to get whatever article of clothing I forgot, I think it took me half an hour to fully assemble all my clothes and get dressed. And it was so frustrating because I would get madder and madder. And the more frustrated I got, the more I forgot stuff. And anyway, just one of those little things that snowballs and snowballs. But despite all of that, it occurs to me that there is a finite ending to this injury. It's not as soon as you would want. They tell you when you rupture your Achilles, this is a 6-month process, and it'll be a year before you are what you once were. Okay, so if I wanted to go back to, say, playing pickleball, which I don't, but if I wanted to do that, I might be walking around in my street shoes, but I wouldn't be ready to play pickleball for a year. So, that's how long it takes. But even at that, it's a year. It is 6 months, and there are definite lines that you cross that say you are now at this level of recovery. And so far for me, that's been the case. So, at some point, I know that I will be completely recovered. And it occurred to me that those of us with systemic sarcoidosis, with chronic sarcoidosis, that's not the case. At least often it's not. So, you can hobble to the dresser and be a good patient, but the best you can hope for is some off-label medication or treatment that will control your situation. Now, I can say, fortunately, in my case, doctors have come up with a concoction that has done that. So, knock on wood, my sarcoidosis is at bay, and it has been for several years now. But as you have heard from the many guests on the podcast, it's a constant struggle. And so even though I am completely bummed out and I'm dealing with all the obstacles that this Achilles represents, I know that there's an end to it. And with sarcoidosis, that's not the case. If you're sitting around and you're wondering, well, what caused this? What did I do wrong? How come sarcoidosis got me, and how come it didn't self-resolve like it does for so many people? Well, it might be as simple as having been breathing in the wrong place at the wrong time. And coming up, we'll have my conversation with Dr. Mark Mallozzi.
I feel like a zombie, just feeding and stumbling.
Hi, I hope you're enjoying the Sarc Fighter Podcast. You may be wondering, what can I do to help? How can I be a part of the sarcoidosis solution? It's simple. Make a donation to KISS, Kick In to Stop Sarcoidosis. 100% of the money goes to the Foundation for Sarcoidosis Research. Look for a link in the show notes of the Sarc Fighter Podcast. Welcome back to the FSR Sarc Fighter Podcast, and joining me now is Dr. Mark Mallozzi from National Jewish Health in Denver. Doctor, thank you for joining me today.
Yeah, thank you for having me on.
Yeah. So you have just been awarded an FSR grant, and you are going to be looking into perhaps what we all suspect is the actual cause of sarcoidosis. Do you want to just tell us what you'll be looking at?
Well, yeah, and part of it is, not necessarily a single causal effect here, but really a contributing factor, we think, in terms of, why people maybe progress versus, others who do not, or certain manifestations that show up in sarcoidosis. And what we're looking at is a particular exposure called particulate matter, and that is part of the pollution in our air and is one of the 6 criteria air pollutants regulated by the EPA. So this is an area that's gotten a little bit of steam building up, I guess I'll say, some 2 recent papers in the last year or so, and is getting a little bit more attention in sarcoidosis specifically, although obviously, for years has had some attention in respiratory health in general.
Yeah, absolutely. So, there's a lot of anecdotal evidence to, it's not a causation and correlation, of course, right? But we had the super high percentage of people who breathed in the dust at 9/11. And then we've got a super high percentage of firefighters, of veterans with burn pits, and of forest fighters inhaling smoke, all of which has a high degree of what you're generally referring to as particulate matter, right?
Right.
And so therefore kind of begs the question, well, what is the commonality of all that, and can we track it, right?
Yeah, and I think, many, to your point, there's not a single accepted version of the story of how people develop sarcoidosis, but I think a lot of us feel that there's a kind of host environment interaction that's important, and susceptible individuals, having some environmental trigger that kind of initiates their disease, and all of the examples that you mentioned are great ones in terms of the impact that the exposures in those cases had on individuals. And they are very complex exposures. There's a lot that was in the World Trade Center dust. There's a lot that people are exposed to in burn pits. Yeah.
Right? Which particle was it?
Yeah. So exactly. And I think some of us think not only is there this host environment interaction, but maybe an environment interaction, meaning, it might not just be one exposure, it might be combination. And we saw that with things like, using particulate matter as an example, with COVID, individuals who got COVID on, days with worse air quality, there was evidence that those people did worse, basically, and higher hospitalization risks and more severe disease.
Yeah. So, how are you going to attempt to figure this out?
Yeah, great question. So,
Yeah, right.
we have a pretty big cohort of individuals here at National Jewish Health who've basically consented to be part of our repository. So we have different data on them over time that can include things like exposure questionnaires, incorporating, self-reported, but data about exposures through their work, in their home, through hobbies, things like that. We have obviously their home address and are working on getting their home address over time to try and, kind of build that particulate matter exposure data for each individual. And then we have a ton of clinical data, of course, through the EMR and also, kind of collection of records, historical records, even outside of our institution, for example, biopsy dates and things like that. So, we're essentially trying to build both a clinical and exposure timeline for individuals, and then look at kind of the correlation between the exposure and outcomes in sarcoidosis.
So at some level, this is going to be in-depth data analysis.
Yes. Yeah, exactly. At least at this phase, we have some future directions in mind. But, for this phase, it's going to be largely data analysis. And then at the end of the project, is our third aim that we submitted as part of the grant, we are going to be trying to look at some biological correlates too, not just is particulate matter exposure correlated with, clinical outcomes, but can we see some biological signatures that maybe are suggesting a mediating effect? But that more to come on that.
So I'm not real conversant with the term, quote, particulate matter.
Yeah.
So, like, if I look at smoke, I see smoke. If I look at dust, I see dust. Are there certain kinds of particles that could be found only in forest fires or only in World Trade Center dust?
Yeah, great question. So
Yeah.
there's different sizes of particulate matter, and then within that, there's different species of particulate matter.
Really?
So yeah, and species is maybe a loaded term there, but it's often what's used. So the size certainly matters in terms of the effects that we expect. So generally, the sizes are broken up into less than 10 microns, less than 2.5, and then sometimes less than 1. And a lot of the health effects that we talk about from particulate matter are associated with the particles that are less than 2.5 microns, and that's often what's studied. And then within that group, there's really kind of different, I'm going to use the word species again, but different species, oftentimes kind of dependent on the source of the particulate matter. For example, PM that comes from diesel exhaust might be different than PM that comes from, a manufacturing plant or something like that. And that in some cases can be studied individually. For example, the group out of Pittsburgh that had published a study earlier this year, or earlier in 2025, in the Blue Journal, had looked at different components of particulate matter and effects that had on pulmonary function testing. So that can be broken down, and we think that there's probably differences in terms of the impact of those things. But really, the PM category, especially the 2.5 category, can have variety of different exposures. They can be organic, inorganic, even microorganisms, many kind of the categories that have been hypothesized or studied in sarcoidosis over the years.
So it could be a microbe, which would be alive, or it could be a very small piece of dirt, which would not be alive.
Yeah, so it's a pretty heterogeneous category of things.
Yeah. And so you mentioned Pittsburgh, so I immediately think, no offense to Pittsburgh, but I think of belching smokestacks and so forth with steel manufacturing. And does Pittsburgh, was there any particular reason that Pittsburgh, and was it the belching smoke from smokestacks that's why they studied it there?
Well, it was the group out of the University of Pittsburgh, so I think, they were obviously interested in their own,
Sure.
patient population. But that study did include a cohort from Canada as well, and that was a little bit more kind of geographically diverse over throughout Canada. And the effects were seen in the group, the individuals being seen at the University of Pittsburgh, but not in the Canadian group. And there were some differences in the size of the groups there. The Canadian group was a bit smaller in terms of the number of participants, so maybe not as well powered as the Pitt group. But there was a difference, and part of what the authors kind of hypothesized was that there could have been differences in what they were exposed to, in not just the amount of particulate matter, but also the kind of subcategories of what was in that.
Yeah. So it makes a case for rural living.
Yeah. Well, yeah, that in as long as we're talking about particulate matter, yes.
Yes, of course.
Obviously we
Yeah.
can get into some other exposures that people have in the rural setting too, but yeah.
Yeah. That's interesting. So, um, so I assume the Canadian cohort was not in downtown Toronto, but it was probably like out in Alberta or British Columbia or someplace out on the open plains, which was not urban. Is that
There were several sites,
okay?
yeah, that they included, so it was a little bit more mixed.
Okay. Yeah. Little known fact about me, I have a minor in Canadian studies.
Oh, really?
Yeah, I think I'm one of 10 people in the country. No,
That's fascinating.
yeah, I went to college right south of Montreal in New York State on the Canadian border.
Okay. Yeah.
Yeah, that for whatever reason, we're 16 miles from the border, so they had a little Canadian studies group, and I decided to minor in it. Long story short. Anyway, so you're going to look at all this data, and you're going to see where the lines cross, I guess, right? We have people in Pittsburgh. We have firefighters. We have all these different things, and you draw graphs and you say, well, wherever these things intersect, that might be a clue.
Yeah.
Kinda. I mean, I'm
yeah.
trying to reduce this, to something that we can all kind of consume here while people are listening to this and driving their cars and working out.
Fair enough. Yeah.
Yeah.
I think that's a good way of saying it. And there are a lot of other factors that go into it, that have
Yeah.
been associated with outcomes and, differences in outcomes in sarcoidosis,
Yeah.
that can include things like household income. We already talked about different jobs. There's sex differences in outcomes in sarcoidosis, certainly. Differences among, race as well, especially in the US. And some of those things can certainly correlate with particulate matter exposure. So, obviously we want to make sure that we're controlling for those things, but also are kind of curious whether this could help explain some of the disparities that we see in outcomes in sarcoidosis, which
Yeah.
previously may have
Sure.
been attributed things like low socioeconomic status, but maybe that's because those neighborhoods have higher level of particulate matter exposure or, kind of along those
Yeah.
lines.
Yeah.
So
Oh, really
yeah,
interesting.
not just the PM, but also kind of the things that maybe go along with it.
So there's two internationally, there's two outliers that I'm aware of, and there's probably more, but the two that come to mind are the high incidences in Japan and Northern Europe. The and So it's like Finland,
Mhm.
that that
Sweden.
area, yeah, Sweden. Those seem like such outliers compared to the low socioeconomic areas that we tend to see it in the United States. Isn't there some kind of a clue there?
Yeah, great point. So, and that kind of gets back to that combination of the individual and the environment, right? So, for
Hmm.
example, the Swedish population, that's probably our strongest evidence of genetic risk for sarcoidosis, right? And
Okay.
particularly acute sarcoidosis or Lofgren syndrome.
Hmm.
The um, Japanese population oftentimes has higher rates of cardiac involvement. So it's,
That's right. Yeah.
it's
Right.
differences in kind of how the disease manifests. So yes, I think there's a a clue that there are important differences geographically. How much of that is more genetic lineage, how much of that is environmental, I think is in some cases, obviously, I gave the Lofgren's example of, kind of more clear genetic correlation. But a lot of that's still being worked out. And, part of what we want to look at is not just, does particulate matter impact lung function, which, that seems to, based off studies both in sarcoidosis and others, but does it impact other manifestations of the disease? And, could that be an important link as to, why certain groups get more cardiac disease or why certain groups get more skin disease, et cetera?
Yeah, interesting. So yeah, when I have neurosarc on my spinal cord.
Okay.
So that's why I'm in this space. And of course, right at the beginning, I was a very healthy, active, outdoorsy, recreational athlete, runner, that kind of thing.
Yeah.
Um, and all of a sudden, boom, and I had to ask, well, why me? Like I eat well and I do all these things and I
Mhm.
don't fit into any of those typical socioeconomic groups. And I looked at my rheumatologist and said, why? And he said, well, you probably breathed something. So
Mm.
that's what he thought. He said he couldn't begin to tell me what, but he said you probably breathed something in, and that was the beginning of it. Okay. So, but it seems easier to associate breathing something in and having it get stuck in your lungs than it does your heart or, and again, to my layperson perspective, to your heart or
Mhm.
your spinal cord. So, how do you think this whole thing works with breathing in a particle and then triggering something within the body's immune system?
Good question. So there has been some both in the lungs and in the skin. There has been some basic science data to show that there are changes in how our body's kind of local immune response works in the presence of pollution exposure and often most commonly particulate matter. Um, that could be how it handles things like viral infections. I kind of alluded to the COVID piece earlier. That could be how it just kind of engulfs or what we call phagocytize different particles and then kind of processes them. There's some signal to suggest that that could lead to more allergic response in some individuals, maybe some more of an autoimmune response in others. And again, has kind of been shown in the lungs and skin, both of which are obviously well exposed to, our environment and oftentimes kind of areas where sarcoidosis manifests. Um, so, I think there is kind of local changes to the immune system in the presence of particulate matter or higher levels of particulate matter based off kind of the more basic science research. And then, extrapolating that to sarcoidosis, that we think, might change the downstream kind of inflammatory response that we see in individuals with sarcoidosis. And, in some people may lead to more progressive disease as opposed to, disease course that maybe, kind of goes into remission in
So
a year or
self-resolves,
two.
as it were. Yeah.
Self-resolves, exactly.
Yeah. Um, so let's say you do this, and how long is it going to take for you to do all of this analysis?
2-year grant.
2-year grant, and it'll take 2 years to kind of figure all this out.
Yeah.
Yeah. And if you get the finding, would you call what you're working on right now a theory or a hypothesis?
I'll go with hypothesis. Yeah.
Okay,
Yeah.
hypothesis. Gotcha. Not quite a theory yet.
Yeah.
Um, if your hypothesis starts to show some correlations, then do you go find an animal model and try and bombard the animal with whatever 2.5 micron particles that you think might be the culprit? Is that the next thing for you or for the next round of researcher?
I mean, I think that certainly could be a helpful next step. It's probably not ours
Yeah.
per se, but one of the things that I think, we would like to see next is a little bit more detailed exposure measurements really, and I kind of use the word measurement there as opposed to estimation, which is a lot of what we're able to do at this point.
Right.
Um, and for individuals and kind of getting that more fine kind of level of exposure and see what people are how that impacts their clinical course over time. The other piece is I'd kind of alluded to earlier, looking at a little bit more of a biological explanation as to these effects, right? So we can say there's data to suggest that particulate matter affects your immune system, and that's important in sarcoidosis. But in individuals with sarcoidosis, are we seeing changes in things like metabolites and other parts of either blood or bronchoscopy samples and things like that kind of fit with their exposure, correlate with their exposure. So there was a paper in Chest, I believe, about a year ago now, that kind of did this in COPD and asthma, and looked at metabolites in the blood and particulate matter exposure, and they were able to identify, matches, basically, right? Drawing those strings or connecting the dots that you had mentioned before, between particulate matter exposure and changes in levels of these metabolites in people who developed what they called chronic respiratory disease, which was pretty much asthma or COPD in that study. So we want to see, is there a similar pattern in sarcoidosis, and then maybe that could inform more kind of research down the road about looking at more into how people develop or progress with sarcoidosis.
Yeah. Wow. I'll tell you, there's just so many unknowns with this, and it just seems like we ought to be able to narrow it down
Yeah.
a little bit. And there's clues everywhere. I'm curious how familiar you, or how much have you studied the World Trade Center issue from the bombings? Is that something that you do as a matter of course, or something that you in particular have had interest in?
Yeah, I mean, we clinically we see individuals still who are part of the World Trade Center health
Really?
program,
Yeah.
and have, obviously we're not based in New York, but we see people who've moved and need care locally. So I'm familiar with the health program itself, and then familiar with the literature at this point, as both an environmental pulmonologist and also as a sarcoid provider, or sarcoidosis provider, the very relevant literature. So
Yeah.
I'd like to think I'm up to speed on that, but
Yeah.
I
Well,
haven't
I'm just
personally
curious
researched.
because I haven't talked a lot about that on the show, and
Mhm.
at some point in my life, if the rest of my life slows down, I really want to dig into it and maybe just do a whole series of podcasts about it. Um, but how telling is that? And could you just share some of, like, maybe the top two or three key observations that people in your field take away from the World Trade Center dust?
Yeah. Yeah. I mean, I think often how I explain it to patients when I'm talking about kind of the um, how we currently think about sarcoidosis, right? Because this comes up all the time in clinic. How did I get this? Where did this come from? Right. I often do kind of use the World Trade Center uh, exposure as the far end of more of the environmental um, end of the spectrum, right? And
Hmm.
then kind of the Lofgrens individuals, who have more of a clear genetic risk as the other end of the spectrum, and say, these are probably the strongest examples that we have, that there's a genetic component in some people, that there's a strong environmental component in another, and then many people kind of fall in between. And it's that in between that we are trying to, obviously all of it, but the in between where there are still probably the most unknowns, as you just said, um, and that's kind of where we're trying to focus this project on. The World Trade Center group, I think, clearly was exposed to so many different things.
Sure.
Narrowing that down to, individual exposures is probably very difficult, especially at this point. But for example, one of my colleagues here has done a lot of work on what has been coined silicose sarcoidosis, and could exposure to silica lead to sarcoidosis or sarcoidosis-like presentation. And certainly that the individuals at Ground Zero at the World Trade Center, had a lot of silica exposure too. So I think there's, many of the exposures that people have hypothesized or looked into over the year, microorganisms could be included in that. Certainly organic and or inorganic materials, are kind of encompassed in that one event or one exposure. And probably sorting those out or parsing those out is difficult, but the numbers are there to suggest that there were definitely higher rates in those people who were exposed. So it something in that composition of exposures was very meaningful.
Wow. I have never heard of the silica sarcoidosis or silicate sarcoidosis. How did you phrase
Silico-sarcoidosis, yeah.
silico sarcoidosis? Okay, that's another podcast. But
Can
all
put
right,
you in
so
touch.
if you look at a timeline of if you were there literally on September 11th and you were first responder or somebody who survived the office building, or if you worked in a nearby office building and that cloud of dust happened when the buildings fell, which is, I think, probably the worst part of it. Yes, is that when most of the dust was created?
And in the
In
day, yeah,
theory?
in the
Yeah.
days that followed too. I
Yeah.
mean, there's still a
So,
lot.
so 2 weeks later, 3 weeks later, do we still see that correlation, or is it mostly those first couple of days?
Yeah, so if you look at the World Trade Center Health Program has kind of defined areas and then timeframes within those areas.
Okay.
So it is, kind of dependent on where you were, also kind of correlates with when. But yeah, it was not just really that day. I mean, there were people who were there in the following weeks, who kind of are included in that program based off the available research. And a lot of what that has looked at are other conditions, not just
Mhm.
respiratory, but
Mhm.
to name a couple of the respiratory ones, things like asthma, rhinitis, sinus disease, etc. Not specifically sarcoidosis in kind of how they defined that cohort,
Mhm.
or who was meaningfully exposed. But there is kind of a radius around Ground Zero, and then a time frame that they have kind of specifically outlined as to who we think was most affected based off what we know.
Yeah. So I was there covering Ground Zero. Of course, I live in Virginia, so the Pentagon was our biggest incident. But about 5 weeks after, I was up there and I had reasonably good access through NBC to stand on a box and look between the buildings, and there were still smoldering ruins and firefighters. It was still very much a recovery scene at that time. But it's not like I felt like I was walking through hazes of smoke or anything like that. So I would assume that I would be outside that parameter.
Probably,
Probably,
yeah.
yeah, yeah.
But it's I don't know the parameter off the top of my head, but when I first looked at it, it was bigger than I thought, or
Really,
bigger than I would have expected. But
yeah,
yeah,
interesting. And then distance-wise, like folks on Long Island, do they have a higher percentage?
my recollection is that it's all on Manhattan.
Oh, in Manhattan. Okay,
Yeah,
so
but
so
I
about
would
as
have to go back
far as
and
the
look.
dust could float, which that's telling also, right? That's a clue.
Right. Yeah.
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 Okay. Now you guys live out there in the mountains,
Hmm.
beautiful Colorado, which I love, by the
Yeah.
way. Um, do you guys have a lot of particulate matter that impacts your patients?
Yeah. It maybe looks better than than it is, I guess, up here.
Really?
The way Denver sits, we're a little bit of in a bowl.
Yeah.
So our air quality is actually not great. we have particulate matter. We also have fairly high levels of ground level ozone for the US. And then obviously wildfires are very relevant exposure out here. So a couple of factors that kind of lead to, you know, probably worse air quality than you would think.
Okay.
Yeah.
So we've got these firefighters out there working your wildfires.
Hmm.
N95 masks, will that stop the microns that you're worried about?
So historically, I mean, they don't have any respiratory protection. The that is kind of in the middle of probably changing. And that's something that there's been a lot of advocates were kind of petitioning the U.S. Forest Service and other organizations, from my understanding, to try and establish a expectation that wildland firefighters have respiratory protection, but historically they have not,
Mhm.
and it has not been part of uh, requirements or what is offered by the U.S. Forest Service for a number of reasons. So yeah, they are very vulnerable individuals in those jobs, both from just a particulate matter exposure on their respiratory health, but I mean that's been an issue and has that's been raised in terms of cancer risk because of
Cancer
toxic
also. Yeah.
exposures
Yeah.
and other things too. So
Yeah. But
yeah.
would an N95
Oh,
mask be suitable?
um, I think they're probably looking at more of an air purifying
Air
respirator
purifying.
for
Yeah.
yeah.
So, okay. Yeah. I know that FSR tried to provide masks to the firefighters in Hollywood when they had,
Mm,
last year, just to do something, just to
hmm.
help those folks out. But this is so interesting. So, if you were a betting man, would you bet that it would be a live microbe or a piece of dirt that triggers this?
I this is maybe a cop out, but I think I'm in the camp of it's probably different things for different people.
It is really
Um,
okay.
yeah. And that might be why part of why it's been so hard to nail down one thing. And not only that, again, I think there's something to the combination of exposures as well. And kind of how, you know, let's just say two exposures at one time maybe kind of modify how your body would react to either of them individually. Going back to that example I used of individuals with COVID on bad air quality days. So, and that is kind of where the our hypothesis, I guess, is derived from for this project, is that the particulate matter and many of the different components of it may be an important kind of modifier of how people respond to things in their environment.
This is just a wild hair that I just had, but does AI help you sort this, or could
Mm.
AI help you sort this in any way? You plug all that data in and see what it spits out?
Um, I think we're probably not
Not there
not there
yet?
yet
Okay.
because of what's going in, right? I mean,
Yeah.
there's a bit of nuance in terms of the exposure estimates and the how we're classifying their occupation and weighting those exposures. Um, Probably is a little much to put it through AI at this point and come and believe what comes
Trust
out
the
the other
results.
end,
Yeah. Yeah.
without going through each individual step and really making kind of intentional decisions on how we're up, using those variables and using those data points. But to your point, I did listen to a very interesting talk within the last couple of weeks about AI being used to to help with the actual exposure estimates and kind of incorporate satellite and ground level data and all that. So maybe on a smaller scale,
Hmm.
not doing the final analysis, but we're getting there.
Yeah. So 2 years, and then you'll publish a paper, and then you or somebody else will take on, determining what these results are and take them to the next level, right?
Yeah, yeah. Hopefully couple papers, and
Okay.
hopefully me and other people,
Yeah.
I would say. So yeah, I think this is probably an area that is, at least I hope, going to pick up steam within the sarcoidosis kind of research
Right. And
world.
you see patients as well as do research, correct?
I do.
Yeah.
Yeah.
Okay. So I'm just curious. So in a city the size of Denver, like I'm in city of Verona, 350,000 people in the immediate area.
Hmm.
My doctor might have 6 sarcoidosis patients total. So that's why I go to the Cleveland Clinic, because that's, they've got the great clinic there where all they see
Hmm.
is sarcoidosis. What percentage of people that you see have sarcoidosis, or how many patients do you have?
Yeah. I'm a little bit maybe skewed. So
Okay.
a large portion of my clinic is patients with sarcoidosis. So it's a mix between um, individuals with sarcoidosis and then occupational or environmental lung disease, so things like occupational asthma or work-related lung disease. So I would say probably more than 50% of the people I see have sarcoidosis. But it's a little bit concentrated in that, there's a couple of us here who see most of the individuals with
Right.
sarcoidosis.
Well, and you guys have a wonderful clinic there for sarcoidosis at National Jewish Health. So,
Yes, we're spoiled with lots of resources to kind of help people. So yeah.
okay. And just uh, how helpful has FSR been to you in your research?
Oh, I wouldn't be happening without them. It has
Okay.
been immensely helpful. I mean, when we talk about kind of the time course of this, and it is a very much data analysis. A lot of that, what takes time and kind of very thoughtful approach is some of these estimates, in particular the exposure estimate. So it is a lot of collaboration with individuals in our biostatistics group, and they kind of rely on other folks in the community as well, in Colorado. So there's a lot of coordination between those folks, and being able to support statisticians and the bioinformatics folks who are helping me with this is essential. So
Yeah.
would not
So
be
it
able to do this on my own.
takes a whole team to do what you're doing.
Yes,
Yeah.
exactly. Hmm.
Outstanding. Anything else you want to add?
No, not necessarily about the project. I just, thank you for having me on, and I think this is a topic that comes up a lot in clinic from patients, and they have concerns about it, they have curiosity about it. So, I'm always happy to kind of talk about it with other people, and I think it's an important area that hopefully will continue to get some steam moving forward. And I'm glad the FSR has kind of made it a priority, and sees the importance in it. It's really a great organization, both from a researcher point of view, and also I think from a patient perspective too. So very, very happy for everything that you guys do.
Great. Dr. Mark Mallozzi, thanks for joining me.
Thank you.
I feel like a zombie, just feeding and stumbling.
Thanks again to Dr. Mallozzi for taking his time to talk with me, and for his very important research into potentially learning the cause of sarcoidosis, if it is in fact something airborne. And let's hope his studies take us to a place where we can really understand the disease and what's going on with it. As I mentioned, the Foundation for Sarcoidosis Research is funding his study. They are granting him $100,000 over 2 years. And so I just want to put in this plug here. Please do consider making a donation to FSR, because a huge portion of donations is channeled into grants for people like Dr. Mallozzi and many, many other researchers who've appeared here on the FSR Sarc Fighter Podcast. And these folks are getting us the answers that we need to find treatments and maybe one day a cure. There's a link to his research in the show notes, but also, I play that public service announcement about KISS, Kick In to Stop Sarcoidosis. be a part of the sarcoidosis solution. And there is a link for that in the show notes. And that donation would go to FSR in the name of this podcast. So either do it if you just go to the FSR website and do the search engine, you'll get to the KISS page, or if you want to go to the show notes in this podcast, you also can click on that and you can make a donation in the name of the FSR. It would go in my name, but it's the same thing. It is the Sarc Fighter Podcast. All right. So, and by the way, it's a good time to contact me if you'd like to share your story. Please email me. That's the easiest way. carlinagency@gmail.com. That's all one word, carlinagency@gmail.com. The official Sarc Fighter song is Zombie by Mark Steyer and the White Hot Lizards. Mark's a fellow Sarc Fighter. The podcast comes out every other Monday. As I'm speaking today, my trusty dog Dougal is curled up on the chair in my office. And if you are new here and you are just trying to figure out what sarcoidosis is, try listening to episode 2 with Dr. Simon Hart. My story is episode 1. Again, please reach out. It's in the show notes, carlinagency@gmail.com. And until next time, keep fighting.
Learn to suffer, you feel pain someday. Learn endurance, your strength will fade away. Dead man walking, trying to keep up the pace. Dead